for tuning into the Golden Girls podcast. I'm your host, Emily.
And I'm Cassandra.
And I'm Sydney.
Today we will be discussing a hot new topic among occupational therapy practice, postpartum care.
Ooh, what a great topic. Moms are so important and deserve a lot more attention after birth. Don't you agree?
Yes, definitely. How about we get started? So what is postpartum care and who is it for?
Thank you for asking. So first, let's talk about the word postpartum. According to the World Health Organization, this refers to mothers who have given birth within 6 weeks. During this time, new mothers are going through a major life shift. They are adapting to their new role as a mom and going through sleep loss and hormonal shifts. Due to this, many mothers are susceptible to mental and physical illness.
So what can mothers have difficulties with in postpartum?
Good question. In postpartum, mothers may struggle with postpartum depression, or PPD, and anxiety. This can affect the mother's ability to carry out the necessary occupations of motherhood. Postpartum depression is very common among mothers, affecting 1 in 8 moms. Not only does this affect the mom, but it can impact their infant as well. Research has shown that infants of mothers with PPD experience issues with their cognitive, motor, and academic abilities, leading to developmental and intellectual delays.
Wow, that's crazy. How does postpartum affect mothers physically?
Well, women in postpartum are also at increased biomechanical risk. Many new mothers suffer from carpal tunnel from repetitive movements, lower and upper back pain, breast pain, and pelvic floor issues. Some moms report nipple pain and mastitis, which is a painful infection of the milk duct. Pelvic floor dysfunction is also a major issue many mothers deal with. This can lead to incontinence. Additionally, the majority of mothers are dealing with physical and mental exhaustion.
It seems like the period of postpartum affects mothers in many ways. How does this impact their performance in occupations?
Well, if a mother struggles with their mental and physical health during the postpartum period, this can impact their role in many ways. A new mom may struggle with both ADLs, IADLs, rest and sleep, leisure, social participation, and health management. Many new mothers are suffering from exhaustion, which makes it difficult to carry out self-care activities like personal hygiene, feeding, and showering. Mothers may also struggle with home management during this time because the majority of their attention is focused on their new baby. When it comes to health management, they may struggle to get adequate exercise and nutrition following childbirth. Since there is less time for themselves, they may feel socially isolated during this time and may not engage in many leisure activities. Finally, during this time with a new baby, it is hard to prioritize sleep, and a mother in a postpartum will most likely not be getting the sleep that they need.
So, how can OT help?
The American College of Obstetrics and Gynecologists is pushing for a more client-centered approach, which is perfect for OTs because we are very client-centered. Occupational therapists have a unique set of skills that they can bring to the postpartum care team, but our value isn't always seen. As OTs, we are trained to treat both mental health and physical health. Occupational therapists should consider integrating themselves into the postpartum care of mothers by creating safe ergonomic programs, pelvic floor therapy, utilizing postpartum depression prevention tactics, providing mental health coping strategies, and administering an occupational profile and evaluation post-birth.
This sounds great. What are the current socio-political influences surrounding postpartum care?
Thanks for asking. Discussing the social determinants of health is important whenever the topic of health is brought up. These are social factors that influence physical and mental health outcomes. Before we dive into sociopolitical influences, something to consider is, what exactly do we know about social determinants of women's health? Gender has a profound influence on how an individual is raised and therefore the path of life they take, both indirectly and directly influencing healthcare outcomes. For example, girls are more likely to be raised to be caring and gentle, which leads them towards caring roles in life. They're less likely to be employed full-time and more likely to have their careers interrupted by pregnancy and caregiver responsibilities. There's an obvious pay gap between men and women who work the same job, but generally, women will work in lower paid jobs and have less control, benefits, and this includes limited ability to take leave. Women's opinions are often devalued due to stereotypes that label women as emotional or irrational, which only further impairs women and their status in the work field. These are the result of gender discrimination and affect economic stability, access to education, where they live, who they associate with, and yeah, you guessed it, their access to healthcare. Gender discrimination also has a more direct impact in healthcare. Women's health issues are more likely to be dismissed and misdiagnosed as something less critical. So how deep does this run? Giving birth, whether that be vaginally or cesarean, consists of a lot of trauma to the body. The process involves the tearing of muscle and tissue and changes the human body forever. However, hospital stays after delivery are typically no more than 24 to 48 hours because of insurance limitations. This time does not take into consideration each new mother's individual needs. Also, this length of stay is an increase after the Federal Newborns and Mothers Health Protection Act of 1996. Before that, there was a decline since the 1970s to 1995 with the aim to demedicalize childbirth. But the reality is, childbirth is a medical procedure, and women need to receive more attention to learn appropriate precautions, learn new ways to participate in routine occupations, how to adapt to new co-occupations that involve the infant, and let's not forget about their mental health. This act also only places time requirements, but does not describe what the care should look like.
Wait, it doesn't describe what the care should look like?
No, but the lack of requirements can be looked at in two ways. One, it highlights that postpartum care has not been taken seriously, but it does open up the conversation for OT to demonstrate their unique value to the postpartum care team. To further support optimizing postpartum care and incorporating occupational therapy, the Affordable Care Act, which influences insurance, including Medicaid, has been a big support for comprehensive maternal care, which would consist of addressing mental and physical health.
So we've talked about why OT would be a valuable addition, but can you tell us how OT would actually become a part of the postpartum care team?
Occupational therapists have a distinct value to develop case management and care coordination systems for their patients. To give you a better idea of what this means, case management is the process of managing autonomy and well-being for patients by advocating, communicating, educating, and facilitating services, which is exactly what OT aims to do. Care coordination is the process of deliberately organizing a patient's care activities between two or more participants, one of which includes the patient, to facilitate the appropriate delivery of healthcare services. As Cassandra mentioned, the Federal Newborns and Mothers Act of 1996 requires health insurance plans to promote coverage for a minimum of 48 hours post-birth for vaginal deliveries and 96 hours for cesarean deliveries. Given that most mothers are discharged from the hospital within 24 to 48 hours, these requirements are not always adhered to. This paves the way for OT to be a valuable asset for new mothers in their transition from hospital care post-birth to their home and new life with their baby. Currently, there are few available resources for mothers to make this transition and adjustment mentally, physically, and emotionally to the significant bodily and life changes the mother has just endured. A mother's care transition should be safe, timely, practical, and beneficial. OTs are qualified to transition patients through multiple settings and can provide support and resources for this transition. Also, optimum outcomes for women and their infants are dependent on affordable, accessible, physical, psychological, and culturally sensitive values during the postpartum period. The postpartum care periods should focus on promoting and maintaining the health of the mother and her infant and fostering an environment that facilitates health, well-being, and quality of life by means of social support and community resources. OTs can provide this guidance by performing an occupational profile, addressing feeding and sleep routines, self-care, social and leisure participation, home environment, home management, and medical management. OTs can address physical health concerns such as pelvic floor dysfunction, educate on common postpartum issues such as de Quervain's tenosynovitis, provide mental health coping strategies and screenings for postpartum depression, create ergonomic programs, home evaluations, and provide recommendations on breastfeeding and education on infant and child development. We can integrate OT as part of the postpartum care team by advocating for our unique value and educating others on the skill set OTs have.
Wow, it sounds like occupational therapy will make a wonderful addition to the postpartum care team.
I agree. This has been a great conversation with you both.
Thank you for listening to the Golden Girls podcast. Let us know what you think about this topic, and don't forget to stay golden. Bye.
Thanks